So my name's Terry McCabe and my husband's David, and before we even got married, we were in our 30s. I was 35 and Dave was 36, and we knew that research shows that the older you get, the more likely you are going to have some kind of infertility problem. So we had, already discussed this. And so once we got married, we were like, let's go for this. Just try to have a baby because we never know what's going to happen. And the rule for doctors is if you're under 35, you have to wait a year before you see a doctor for any problems. But if you're over 35, it's 6 months. So as soon as we hit the 6-month mark, 6 months after our wedding, we went in and started doing all the tests. Yeah, they take a lot of blood. I always joke that infertility doctors are vampires because they take a lot of blood, a lot of blood tests. They test for everything, all the hormones, anything and everything, because you never know, like your thyroid might actually be causing problems and that's why you can't get pregnant, or you're having, you never know what's actually your infertility problem. So they test everything. And an advice that I'm on a support group, and advice I always tell people is, if your doctor's not testing anything, get a new doctor, because that's really the problem. Especially if you're seeing an OBGYN and they're not doing anything to help you, go get a new doctor. And especially if your insurance will cover going straight to an infertility doctor, go there, because they will test for anything and everything. So research shows that 1/3 of infertility problems come from the female, and 1/3 comes from the male, and then 1/3 is either a combined or an unknown factor. So they have to test both of you, and you never know what your diagnosis is going to be. And we were living in England at the time, and so we were under socialized medicine. So from the time we first started doing testing to when we actually saw an OBGYN, which is, they do things completely different in England, was 11 months. And it took forever for us to get in to see a specialist. So many clerical errors. It just drove me crazy when we finally got into the doctor. And so because it was 11 months, we had to start the testing all over again with the OBGYN. So then they finally decided, nothing's wrong. We need to do surgery on me. So they had to do a laparoscopic surgery to check whatever they do. So what they do is they stick a dye up into your uterus and they take x-rays and watch the dye move. So the dye went into and went through, but it didn't come out. So they were like, we don't know what's wrong. At that point, Dave and I were ready to move back to America. And then after we finally got jobs and insurance, it was probably a year after the surgery back here in America, and I went to a OBGYN specialist who does laparoscopies in American Fork, and he said that it's not worth it to do another surgery. Chances are you have no fimbriae, and to do surgery to try to fix that, the fimbriae are so delicate that you'd actually do more damage than you would good. So he just sent us straight to a fertility doctor and said, you're going to have to do IVF. And so that's my diagnosis, is I have no fimbriae. And now I get this look from everyone like, what's that? Right? I don't remember what a fimbriae is. Yeah, so the fimbriae are the little teeny fingers at the ends of the fallopian tubes, and they move the eggs from the ovaries into the fallopian tubes, and that's where the eggs get fertilized before they move into the uterus. And so because I have no fimbriae, there's no way for the eggs to move into the fallopian tubes. So I have no idea where my eggs are going when they're being released. It's like, who knows? So that's why I have to go straight to IVF, skip all the other, there's so many other treatments you can do. There's drugs, there's IUI, there's a ton of other things, but because of my diagnosis, none of that was going to work. So IVF, it's expensive, you know. Our insurance will cover $10,000. And everybody's insurances are different, and you never know what they're going to cover and what state you live in. You don't know. Some states are better. Massachusetts is the best. They will cover basically everything. Yeah, so if you live in Massachusetts, good for you. You're one of the lucky ones. There's a few other states where infertility is covered in some better forms. Utah sucks. There's nothing. It's just whatever your insurance company feels like. There was a bill that was passed a few years ago, but it was an opt-in. So insurance companies could either cover it or not. It was a completely useless bill. And it also covered adoption services too. Like insurance companies just help cover adoption, but it's opt-in. So yeah, it's basically useless. And it wasn't worth it. And that was being passed around the time Dave and I were starting to do IVF. And depending on what kind of things you need, because Dave has no problems, we didn't have to do ICSI, which is when they force the sperm into the egg. But so we just had a plain old IVF. And so we did that first cycle, and it turns out our insurance won't cover medication. So thankfully we had enough savings that we could cover. It was over $2,000 just for the medication. Yeah. And and our insurance will cover regular OB services. So when they do those kind of things, the insurance will cover it. But if they do special fertility, like egg retrieval, yeah, they won't cover that. It's covered under the $10,000. So once we hit our $10,000 cap, in the middle of our second IVF cycle, we have to, so we're paying for everything ourselves now. But so the first cycle we did was in May of 2014, and we didn't know what we were doing. We were just doing what the doctor told us, and I was taking all the medications, which, oh goodness, it would make me cry. The drop of a hat. I would stand up and I would cry. I would breathe and I would start crying. Oh my gosh, it screwed with my hormones like crazy. So that, and the medications, you know, they do different things to everyone, but that was mine in that first cycle. I would just cry at everything. It was crazy. Really, yeah. My poor family, they thought I was nuts. So, yeah, we did the whole cycle, and we didn't know what we were doing, so we just expected, this will work. And they were only able to retrieve one egg, but it fertilized, and so for IVF, they either do a day 3 or a day 5 transfer. And because we only had one, our doctors thought it would be better if we transferred on day 3. So that's what they did, is they took it out, and then after 3 days they put it back in, and then you just wait, and you have this 2 weeks of, they call it the horrible 2-week wait. And gosh, it really sucks because you don't know. You don't know if you're pregnant, you don't know if you're not, and sometimes women can start having pregnancy symptoms in those 2 weeks, and sometimes you don't. So you just don't know until you get that first blood test, and then they call you and tell you, and that was so hard. That first cycle, and we just expected it would work, and then it didn't, and it was just like having a miscarriage and losing a baby, and we were so devastated. And, we were living, because we had just got back from England, we were living with my parents and had to save up to buy a house. And after I got the phone call that I wasn't pregnant, I texted Dave and told him, and then I went downstairs and told my mom, and she just gave me this big hug, and she was just as devastated as we were, and it was really hard. Well, it took us, so that was in May, and it took us about all summer long to recover from that emotionally, because that failed cycle was just too hard. One of the things that we did to help in our grieving process was to name our embryo. And not everyone does that, but we decided to do that because it actually helped for us. So we named our embryo Darcy. And we keep pictures. So before they transfer the embryo, they actually take a picture of it to see how well it's developing. So we keep a picture of all of our embryos. Like it's a family picture. So because we kind of wiped out our insurance, a big chunk of it, we had to save up for the next cycle. And that actually took a while, almost 2 years. And so we didn't have enough money until February 2016 to do another cycle. And during that time, we were able to finally buy a house. And right before that, my mother actually died. So that just made it worse. Not having your mom around that actually loves you and wants the best for you. It was really hard. The hard part about infertility is it isn't just a medical problem. It's a emotional and a financial, and I know a social worker who did some preliminary research here in Utah, and she found that the hardest part about infertility is the financial problems, and then the how it affects your relationship with your spouse. I'm the one with the infertility diagnosis, but so many couples in Utah, it's either both or the husband, or sometimes it's unexplained infertility, or what they call secondary infertility, where they were able to have a child and then all of a sudden nothing. So, it can really affect couples. I have a infertility friend. Her husband actually divorced her because he couldn't handle it. And he went and found another wife who could get pregnant. And so it was really hard on her. And, when something like that happens, you just give them a big hug because you don't know what to do when someone just leaves you like that. But it's actually me. And one thing I've noticed is that for women, it's an immediate reaction. As soon as I found out I wasn't pregnant, I immediately went into this depressive state. And, well, I was almost into depression. It's just general sadness. But my husband, it took months. He has a delayed reaction every single time. Every time that it's a failed, it takes months for him to finally, his body, his brain is like, Uh, yeah, it's funny. On the support group I'm on, everybody, all the husbands, it's like a delayed reaction. You never know when it's going to happen because it's just months later after the fact. So we finally had enough money and did another cycle in February 2016. And our fertility doctor's wonderful. She decided, because of our age and because I was only able to produce one mature egg the first time, she put us on a different medication protocol. And she called it a mini cycle. So it's a minimal stimulation. And it worked because I was able to produce 2 mature eggs this time. It doubled, so that was good. We did the whole cycle and everything, and we did another day 3 transfer with both embryos, because neither one of us have a problem with having multiples, twins, or we really hope just twins, because triplets and quadruplets, oh gosh, that would kill us. But yeah, so we decided to transfer both, and it didn't work again, and actually this time it wasn't as hard for me, it wasn't as devastating, because of the first. It's kind of like, again, not pregnant again. You know, you never get that positive pregnancy sign. So it was just like, all right, let's save up money for another time. But of course, David took months before he reacted to it. And so after that cycle, we had a follow-up with the doctor, and she actually suggested to us to do embryo adoption. Technically it's called being an embryo donation recipient, but a lot of people just call it embryo adoption. So someone else who's also done IVF, and they've been successful and have as many kids as they want, but they have all these leftover embryos. So they decide to donate them to someone who can't produce enough embryos like us. So we got put on a waiting list at our clinic, and they consider it a closed adoption. So we don't know who the donors are, and they don't know who the recipients are. And this is called third-party reproduction, and a lot of times states won't cover this, and insurance companies won't cover it because it's third-party. And third-party is also considered like sperm donors or egg donors or surrogates or anything like that, where another person has to help you get pregnant. And because we're Mormon, the church does not like that. But we decided to do it anyway, because there's that little line in the handbook that says couples can decide what they want to do. The church does not like it, but they will accept whatever your decision is. So, and we had talked to the bishop, but told him about our problems. One of the side effects of the second failed, well, actually it was right before that, in 2015, for a long time, it was really, really hard to sit through church. So my husband decided he just couldn't go to church anymore. And I had decided a long time ago, because of my experiences on mission, and I had seen too many women going to church with their kids without their husbands, and they were just heartbroken and devastated. And I decided a long time at that time, if my husband ever decides to stop going to church, I'm not going to go with him, because I'm not going to break up our marriage. It's us. It's either you go and I go, or if you don't go, I don't go. So for a long time, I didn't go to church because it was really hard on my husband. He couldn't sit through sacrament meeting. He couldn't sit there with the little kids, and it was really hard for him. I was willing to stick it out and just suck it up and have my heart broken every Sunday, but it was just too hard for him. So when the bishop finally called us and asked us if we would, what's going on? I haven't seen you in a while. You know, he's actually really nice. Not all bishops are like that. I've heard some really horrible stories. But he was really, he understood, and he just was like, okay, come back when you're ready. After our second IVF cycle failed, we finally went back to church, and we got our temple recommends renewed, and things are going well, much better now that we're going back to church. I think it's easier. So we were on the waiting list for the embryo donors, and they told us that it could take up to a year because you never know who's going to donate or how many embryos are going to be donated. It can be 1, it could be 10, you never know. So we expected to have a year to save up enough money to do another cycle, and this would be a frozen embryo transfer instead of IVF. It's kind of like the second half of IVF because the embryo is already made, so all you have to do is transfer it into your uterus. But then 4 months later, we got a phone call and said there's 2 embryos for us. We were so excited. I had no idea that it was only going to be 4 months. We were so happy. So we did everything that they have a checklist of everything they needed us to do. Every clinic is different. Sometimes because some people consider it a real adoption, they want you to do a home study, like you would do a adoption for a baby. They only had us go do a psych eval. So we had to go to the psychologist up in Salt Lake, and it actually wasn't a real psych evaluation on us. It was kind of different. And mostly what she talked about was, how are you going to tell these kids how they were made? She said that a lot of children in adoption, if they're told from the very beginning that they're adopted, then it's much easier for them. But if you kind of don't tell them and keep it a secret, when they finally find out when they're an adult, it shocks the system, and it's really hard on them. And so she said, start when they're babies. Even there's actually books made about, and you can read the books to the kids to help them get used to the idea that, mommy and daddy didn't make me, but mommy did grow me, and it's a little different, but it helps if you tell them from the very beginning. So that was really good to help us know that. I mean, my father and my uncle were adopted, and they always knew that they were adopted. And I grew up always knowing my father was adopted. So I knew that was a good idea. You start when they're really young, and so it's just not really a big deal that they're adopted. So we had to do the psych eval. We had to pay for storage fee for the because they were still frozen. So we had to pay the frozen storage fee, which was $500. And then we had to start all the testing all over again, all the blood work. But I was the only one who had to do anything. Dave didn't have to do anything. He just sat back and took me to appointments and sat on his phone and watched his Aston Villa and soccer team. So yeah, I had to do all this blood work all over again. And then in the middle of the testing, my doctor suggested we do a endometrial biopsy, or sometimes they call it a scratch test. And what they do is they go in and take some uterine tissue to see if there's anything wrong preventing you from getting pregnant. And so I had to go and do this, and it showed that I had a bacteria in my uterus. So I had to take some really powerful antibiotics for about 3 weeks, and it killed it. But I know people who did the same thing and it didn't kill their bacteria. So I was really lucky. It killed the bacteria. And even though it pushed us back, basically we were going to do the transfer at the beginning of November, and it pushed us to the end of November. And to do this, and it was no big deal. Oh, and I should say, so for our second IVF cycle, we applied for a grant to get a discounted rate and it only worked at our clinic. They have some kind of grant program. So that's what we did. Well, and it works for a year. So Dave wanted to wait until 2017 to do our embryo transfer. But when we found out we had these frozen embryos, when we had to do it in the year because it was cheaper. It was like a couple of $1,000s cheaper, which helped. We also did a yard sale fundraiser, which actually gave us a lot of money, and people just donated too. You know, I had family and friends that just gave us hundreds of dollars just to help us out. And I was so grateful for them for helping us. And so after the biopsy and taking the drugs, and we did a transfer on November 29th, 2016 with these donated embryos, and I immediately started farting like crazy. Oh my gosh, I had never had that happen to me before. I'm like, what the crap? I'm not even eating Mexican food. I'm farting like crazy. And for 2 weeks, that was it. I was farting. And then all of a sudden I started having pregnancy symptoms. And sure enough, on after a 2-week wait, they said I was pregnant. And my HCG levels were over 200, which could possibly mean I was pregnant with twins, but we weren't sure. Even though we transferred 2 embryos, we had no idea if both of them would attach to my uterus or not. But 200 is a good level. And then a week later, I was up to 800, which is another good sign. And then we had about a week and a half later, I did 2 weeks later, I did the first ultrasound. And they do ultrasounds early with fertility treatments because you have an increased risk of miscarriage with any fertility treatment. So they do more blood tests and they do more ultrasounds, especially in their first trimester, just to make sure that your pregnancy works. So that first ultrasound, there was 2 yolk sacs, and one we could hear the heartbeat pretty strong. It was really good. And the other one, she couldn't find a heartbeat, but you could still see the little growing embryo. And she said, well, let's wait till next week. Maybe I just don't have the right angle and I'm not, catching the heart rate. So a week later, she does the heartbeat, and sure enough, baby A, there was actually no baby anymore, but the yolk sac was still there. So they decided the baby A stopped growing at 6 weeks, but baby B had a heartbeat and still going strong. The very next day, so Dave and I have been doing all these side jobs, secret shoppers, we've been Uber drivers, we've been just doing tons of different things. I started a YouTube channel to try to get money because you can do that, and do anything and everything just to get enough money to pay for all of this. So I was standing in line at one of the movie theaters that we do. You do movie checks, you get paid. Basically, you get paid to watch trailers or watch a whole movie. And I'm standing in line to talk to the manager, and sure enough, it feels like I'm peeing my pants. So I go to the bathroom, and I have this gush of blood. And fortunately, our clinic has a second office in Murray, and I was close by, so I just drove over there. And the nurse does an ultrasound, and she can't find a heartbeat. And this is the day after, the day before there was a heartbeat, and the very next day there's no heartbeat. And this is on a Friday, and she's like, you know what, maybe I'm just not doing it right, but you could possibly be having a miscarriage, especially since, there was this huge gush of blood. So she said, just go on bed rest for the weekend, and then Monday morning we'll get you in and we'll do another ultrasound just to make sure. So that's what I did. I was on bed rest, basically. I didn't do anything. My husband was wonderful and took care of me and brought me food, and I watched a lot of Netflix. And so Monday morning we go in, and the nurse does the ultrasound again, and there's no heartbeats. And she basically says, yeah, it's a miscarriage. But later that afternoon, we get a phone call from the doctor, and she's like, you know what, I want you to come in and do another ultrasound. She said, you still have to take, so that was Friday when I had possibly my miscarriage. And they said, you know what, you still have to take all your medications this whole time. So one of the hard, when you're doing a frozen embryo transfer, so you have to do a progesterone and oil injection in your butt. And it's just horrible. And that's like the worst one. And my poor husband does it because it's not like you can do it yourself. It's so hard. So he, while I was on bed rest, I just turned over, laid on my stomach, and he did the injection. And it was so much easier because when you're standing up, your muscles are in contraction, and so they're trying to prevent the needle from going in. Gosh, if I would have learned that earlier, lay on the bed, you can do it then. It would be much easier. So we still had to do all these injections. The doctor called us on Monday afternoon and said, you still need to take your injections. Okay. So then Tuesday morning, really early, I had another ultrasound with the doctor. And Dave had been going to all these with me. But Tuesday morning, he finally had to go back to work. And so she said for sure that I had a miscarriage. There's no heartbeat. And then she gave me the options of how you do a miscarriage. You could just let it happen naturally, and if that doesn't happen, then it can actually cause problems if the sacs erode in your uterus. And so you can either do medication or a DNC, and we just decided to do a medication to make it easier. So over the weekend, when we knew that it was possible I was having a miscarriage, we had decided, okay, Martin Luther King Jr. Day is coming up, the long weekend. Let's go get away. If it is really a miscarriage, we need to go away, go to the beach, go somewhere warm, because it was really horrible. Bad weather in Utah, snowing like crazy, freezing cold. Yeah. So Tuesday, after we knew that it was confirmed that I had a miscarriage, we made plans and got a rental car. And so that Friday we left and went to California went to the beach for a long weekend, and we felt so much better. And because that whole week I could feel the depression coming on. I knew it was going to happen. Just like if I had postpartum depression or anything like that, I could feel it coming. And as soon as Dave and I got in the car and drove to California, it was gone. I felt so much better, being on the beach. Even though the locals thought we were crazy getting in the water in January. It wasn't cold to us. So, yeah, we felt so much better. And while we're there, we decided we wanted to do it one more time. Even though we're in our 40s now, we want to try one more time with the embryo donation. And if it doesn't work, we'll just be cranky old people. And if it does work, then we get to be parents again. And so yesterday, actually, we had a follow-up with the doctor. So when we came back from California, I took the medication for a miscarriage. I don't know who invents these things, but you don't take it orally. You have to put it up your vagina. You have to put these pills up there. And I'm like, are you serious? Who invents this crap? The stuff we have to do just to have a child. It's just crazy. So, yeah, it took a few hours, but then you start bleeding like crazy, and mine kicked in just as Dave was coming home from work, thank heavens. So I'm sitting on the toilet, and I'm in massive pain because I'm passing the first yolk sac, and I didn't think I was in a lot of pain, but it made me throw up. So fortunately, our tub was right in front of me. I'm sitting on the toilet passing this yolk sac, and I'm throwing up in the bathtub, and my poor husband's like, let me know when you're done. He's like, this is disgusting. Poor guy. Yeah, so I threw up, and it was bad. And after I passed the sack, I went back to bed and I felt good. So I'm like, well, I better drink some food and drink something and eat something so I don't get dehydrated from throwing up and from bleeding so much. And then a couple hours later, sure enough, I do it again. Sitting on the toilet, passing another sack, and I'm throwing up in the toilet, in the tub. And poor Dave, he ends up, we have a detachable shower head, and he's trying to get rid of the throw up like this. And he ends up breaking it off the wall. Yeah, break the shower, poor guy. So after that, though, I didn't have any pain. I bled pretty severely for a couple of days, but I was pretty good. So yesterday at our appointment, the doctor said they had to do a blood test to make sure all the HCG levels are back to normal, back to zero, and all the hormones are out of my body, except that my hair has gotten really curly ever since I got pregnant. So I don't know how long that's going to last if I still have HCG levels in my body. But she also said to us that our doctor's wonderful to us. She has to deal with this for thousands of her patients all the time. She's really compassionate. So she told us yesterday that she already put us on the list for embryo adoption. And she didn't even know if we wanted to do it. She was so nice. I mean, we had decided to do it, but she was wonderful. So we're already on the list, and we don't know. We're just waiting now. You have to make sure that my body's recovered from the miscarriage, and then we have to wait to find out when we're going to get some more embryos. And we don't know how many we're going to get. You never know. Someone may donate and decide that we can get all of their embryos, or we can just have one. You never know. Took 4 months last time, so I don't know how long it's going to take this time. We don't know. And we just did our taxes too. We found out we spent over $13,000 last year in infertility treatments. Yeah, the taxes do help. Tells us how much we've spent. But because of that, we get a massive refund. Biggest one ever. So that's going to be put back into the pay for infertility treatments. Because we're not going to be on the grant anymore. That's expired. And so basically we just have to start saving our money and doing a bunch of extra jobs. And I signed up to be a substitute teacher so I can get money from that. And we're planning on, as soon as the weather gets warmer, we'll do another yard sale because that was actually really successful. We saved a bunch of items from the last yard sale to do another one. And you never know what's going to happen next. That's the hard part about infertility because it's a lot of unknowns. You don't know what's going to happen next. You don't know whether you're going to get pregnant with one baby or two babies or no babies, or if what you're going to end up doing. After the first failed IVF cycle, we started taking some foster care classes to become foster parents because that's the cheaper way to adopt is through foster care, because regular adoption can be from $20,000 to $50,000, and that's just more money than is doing infertility treatments. And sometimes those adoption agencies can just gouge you with money. So we started taking some foster care classes, and it's just heartbreaking. Some of the experiences those poor kids have to deal with, it's hard for us to sit through those classes. Besides the fact that they're 4 hours long and you always end up sitting in a hard chair that's really uncomfortable, but hearing all these hard things about these poor kids. So we slowly take those classes whenever we feel ready, because you emotionally have to be ready for that. And after all the emotions that we go through with the infertility treatments, sometimes it's just too hard to do foster care. So we take our time and do it slowly. One of my mission companions, she works for DCFS here in Utah. And she keeps encouraging me to do it, but sometimes it's just too hard. I think the biggest thing is financially, because, gosh, it costs so much money to do this. Frozen embryo transfers are cheaper than IVF, and IUIs are cheaper than even that. But sometimes, and you can do a lot of times insurance companies will cover IUIs. And that's when just go look up IUI. It's much easier to just look that up than for me to explain it, because I've never had to deal with that. But yeah, financially, basically all our money, everything goes back into our savings account to pay for the next IVF cycle. So if we can't go on vacation, I haven't been able to go out and visit my nieces and nephews in Oklahoma because my brother's doing his PhD out there. We haven't been able to go back to England to visit Dave's friends and family. And we bought an old house, so the fridge is starting to make weird noises. The kitchen sink is broken. We have a leak in our roof in our back bedroom. One of our car doors is broken. We have all these things that need to be fixed, but we don't do it because we don't have the money. We're using everything we have to pay for IVF or pay for the next cycle. So if we can't go out to eat, with someone, it's because we're saving our money in, especially if you have a friend or family member who says no because they can't do it because they don't have the money. It's because they're using everything they possibly can to pay for the next cycle. So as a friend or a family member, go over and just be a friend and talk about something that has nothing to do with babies or infertility. Or, when I was going through my miscarriage, my visiting teacher came over and we talked about stupid TV shows that we really liked, and that actually really helped me. You can ask to help organize a fundraiser for your friends or family. GoFundMe accounts don't usually work. You can only get a little bit sometimes if you're lucky. Other kinds of fundraisers do help. You can go, so there's a charity here in Utah called Footsteps for Fertility, and they have a 5K every year. And the way you raise money and your chances of getting your IVF paid for by the charity is by getting as many people on your team as possible, which means that you have, so if you get 10 people on your team, that means you have 10 chances in the lottery of them picking out your name. So if they say, we need you to come run this 5K with us, say yes. Even though you're probably just going to walk it, it's okay. But just sign up and help them get this chance. There's another couple that just did a charity giveaway, was the Ellie and Jared YouTube channel. They were giving away one IVF cycle. And so many people decided to donate more money that they were able to fund a whole bunch of other IVF cycles for other couples. And one of my friends got picked, and I was really excited for her. And then one of the radio stations also just did basically a, I don't know, what did they call it? Contest. See who can get a free IVF cycle with one of the other clinics in Utah. And it basically, they were trying to get their friends and family. Whoever got the most votes got the free cycle. And which is kind of, Hunger Games like, but it's kind of sad. But that's how a lot of people get their IVFs funded, is because they do contests or fundraisers. There are grants available, but Dave and I don't qualify for any of them because we're too old, or we don't have the right diagnosis. You can also sign up for clinical trials, but you have to have the right infertility diagnosis, and we never qualify because we're too old. And they do give you medical loans, but those are so freaking, the interest rates on that sucker, it's killer. It's sometimes easier just to take out a personal loan on the bank. I know a lot of people who have did a second mortgage on their house. I know people who have 3 or 4 or 5 jobs just to pay for this. I mean, it just really sucks. So just being a friend sometimes, paying, if you want to go to the movies, pay for your friend's movie ticket. Even little things like that can sometimes stress you out so much. I mean, my husband went through this. Gosh, he was driving me crazy. He's so stressed out with how much money we had to spend with doing 2 cycles last year that I took over all the finances because it was driving me crazy because he was going nuts. Yeah, pretty much. I'll tell you a crazy story I heard. So this couple had been fundraising and saving and doing everything they possibly could to save up enough money to pay for an IVF cycle. And his family was, this happens a lot. A lot of people don't have supportive families. And they're just like, what, you can't get pregnant? Just deal with it, right? They don't care. So apparently this husband worked for a family business, and the brother and sister were in charge of it. And they were talking at a family get-together, and the brother said to him, look, I'm so sick and tired of you talking about infertility. He took out $50 and said, here, don't ever speak about it ever again. Here's your money. And then later, the sister did the exact same thing. And turns out that they had been withholding money from his paycheck for years. And they found out it was $100,000. They'd been withholding money. And they ended up having to sue his own family just to get this money back. And it's like, seriously, we've been fundraising all this time to pay for IVF and you've been withholding this money from me. Come on. It was just kind of sad how a lot of people don't have the family support or friends support. They just don't care, don't want to know. Who cares about your medical problems? Who cares that you can't get pregnant? Whatever. And a lot of times that's just really sad. Dave and I have been really lucky. We have family that have been so supportive and friends that are just amazing, that they will help us out with anything. They'll just be a friend, Sometimes if I just need to talk to a friend and cry, they'll just let me do it. That's basically how you can be supportive. A lot of examples. So I guess the basic, easy first thing to do, some of us call it the gateway drug, is Clomid. Clomid or Femera. Those are the easy things. Sometimes it's the female, the wife that takes it to help with, whatever kind of egg problems you may be having. I took that. It was kind of a joke. And a lot of times people will have reactions to Clomid too. I had a low-grade headache that just didn't go away. And you only take that for about 4 days. But also, the husband can also take Clomid if they're having sperm problems. And so a lot of times people don't understand the different kind of sperm problems there can be. So there's either sperm count, where you're actually supposed to have in the hundreds of millions of sperm every 48 hours. The men produce that many sperm every day. And so if you're only having like 5 sperm, that's not good. I've heard of that. Motility, which means they need to be able to move and get to the egg. If they can't move and get to the egg, that's low motility. Morphology, which means they can either have 2 tails or 2 heads or a weird shaped head. That can cause genetic problems, actually. There's something else. Anyway, so there's actually a whole bunch of problems. And one thing people don't realize is that how you get a girl or a boy is actually from the male. How much testosterone is in the sperm. And because they produce so much sperm in 48 hours, then the sperm amount is different. So that's a lot of times why they'll take Clomid or some of the other drugs that will help with that. Just general medications or even hormone injections. Sometimes the female isn't ovulating, and so they have to take medications for that. What else? I don't know all the names of everything. I just know so IUI is something uterine insemination. Basically, the husband will have to go produce a sperm sample, and then when the wife is ready to ovulate, then they basically, it's not really a turkey baster, but they stick a turkey baster full of sperm and put it in her, because sometimes that's not working. ICSI, I don't know what it stands for, but that's basically when you have to inject the sperm into the egg. They stick everything in basically a petri dish and they force the sperm into the egg so it will fertilize. There's so many different things. So I also had a thyroid problem, so I had to take thyroid medication. I had a friend who ended up living in a house full of mold and they had to move. That could also causing her some infertility problems. So you never know what's causing. It can be also environmental. Do you have mold in your house? That's going to be causing a problem. So, and there's some new research that shows pollution actually can cause problems in sperm. So that's a huge problem here in Utah. So you'll have to, there's just so many different tests and so many different ways you can have infertility. Really, you just need to go to your doctor and start getting tested for anything and everything, because you never know. But someone might also have other previous medical history, like especially if you've previously had cancer and had to do chemotherapy. A lot of times the male, they'll be completely infertile after chemotherapy. There's a brand new chemotherapy drug for women that helps with their egg production. So they're doing some new testing about that. So you never know what your other health conditions can actually also cause. Like there's PCOS and endometriosis as well. And PCOS is polycystic ovary syndrome. And that means they have cysts on the outside of your ovaries, and that can be pretty painful. Endometriosis, I wouldn't wish that on anyone. That's extremely painful. That's tissue growing on the outside of your uterus. That's bad. Yeah, you never know. Other things can be causing your infertility. So you want to get tested for anything and everything, basically.